we're now going to start with our speakers. So Anne, if you can, that's it, that's lovely. So Tony, I think we need to take unmute you. Lucy, are you going to do that? Lovely. Tony, can you hear me okay?
Fine, yeah.
Fantastic. So Tony, thank you so much for being with us this morning. And we're going to do this as a bit of a question and answer session. So perhaps you could start by just telling us a little bit about yourself and what it's been like living with dementia.
Well, first I was very suicidal. I was diagnosed 7 years ago with Lewy body.
Motion detected at your front door.
Sorry about that. I've got a security system and it keeps letting me know what's happening.
That's okay.
Yeah, and my brother, who was 2 years younger than me, died of motor neuron disease. When they diagnosed me, I thought I had motor neuron disease, and he went down within 3 years. Killed him, and I thought that's exactly what I had. I thought I'm not going through what he's gone through. So I plan a way out. It was a totally wrong thing to do because I had a family, grandchildren, great-grandchildren. Yeah, I was a lorry driver for 35 years. Spent a lot of years on the continent and all around Europe. And my problem started when I was going to the wrong country. I got down to Spain when I should have been going to Italy.
Oh, wow.
And I had to keep stopping, looking at my notes and thinking where I'm going. And then coming back, I was going to the wrong drop-off point. Instead of going to London, I was going to Luton. And then my wife said, you've got to go to the doctors. And it was a very simple diagnosis. I was sat in a room with my arm on a table and my finger and thumb were rolling like this. And she said to me, how long have you had the P-roll? I said, the P-roll? She said, yeah, this. I said, I don't know, I've never noticed it. So I think we ought to do a scan. Came back with Lewy body dementia. That was the simplest way she could notice what it was. So, what's it like having dementia? I don't think there's any word that can describe what's it like having dementia. It's very bad. It's very hurtful. It's very sad, and there's not a lot you can do about it. You've got so many people who can discuss dementia. You've got experts who I don't think, unless you've got dementia, you are an expert. They haven't got dementia, so it's looking through my eyes. You can see dementia. It's like going and walking into a fog. You can't see where you're going. And that's when people ask you questions, your brain's a fog. It's like a nursing home. I've just come out of one on Monday. I go in every couple of months. And they come and ask if you want a cup of tea. And your brain's got to decipher that it's your wife who makes the tea. She brings it to you onto the kitchen table. And while you're thinking all this, she's gone. She's not answering her. So come with different questions. I'm going to have a cup of tea. Do you want 2 sugars or 1? That's taken that fog question out of the equation. And another typical thing is a lot of dementia ladies have invisible babies. And I did see a typical example where a carer went up to one lady who was nursing her invisible baby and says, come on, lunchtime. She says, yeah, I'll be there in a minute. She said,
motion detected at your front door.
Just put the baby down. And she says, you know you haven't got a baby, so come on. Which the woman just went. And where she could have come in and said, okay, lunchtime's ready, put your baby down, put her to sleep. When you're ready, come on down. You know, there's ways of wording to somebody with dementia. Coming in with a loud voice is dangerous because it gets your brain thinking that you're being attacked. There's various things like that. But I think more training colleges with care students who are going into this field. I think more training with dementia, the approach, dementia, you know, is and how to speak to somebody with dementia. Demands are no good, strong questions are no good. But when you're in that fog, your hearing improves. Like a blind person, their hearing improves. I don't know how many fold, but it improves a lot. And you hear everything. And when you hear a loud voice coming at you, you get very frightened. Oh. So
yeah,
go on.
Very struck by that idea that trying to remember that it's going to take longer, in a sense, for somebody to think about the question, and that if somebody then goes away, like you were saying with the person with a cup of tea, that actually you haven't asked the question in the right way, or you haven't given enough time for somebody to respond.
I think on handovers in hospitals, nursing homes, that sort of thing, when you're dealing with dementia patients, sometimes the handovers are not complete.
Okay.
You know, oh, John's okay, he's been good today, and that's it. You know, whereas John might have messed himself, wet himself, fallen out of bed, you know, done anything, but it's not been passed over. So a stronger link in the nursing homes would be better, and better training, because you can get young girls coming in off the street, they've had no training, and yet they've got to deal with a severely disabled person. So training for them, 1 day, 2 day training, you know, will give them a basic idea of how to speak, what to do, you know, how to, so excuse me, my arm's shaking like anything.
Are you okay?
Yeah, my Parkinson's getting a bit erratic.
Okay. And if we had more training, what would you like to see put into the training?
I would like to see the approach to a dementia patient.
Yeah.
That guy or that lady is sat in the chair.
Yeah.
Their mind is nowhere. Whereas you know, they could bring photo albums in, music, calm them down, look at the photo albums, play little games, you know, any sort of games.
Yeah.
Just to keep the brain active. Whereas in some nursing homes, one particular I've been in, you know, that door's closed on you from breakfast to dinner, from the dinner to tea, or lunch to tea, that door's closed. So no brain activity at all, especially during lockdown. Nobody's gone in and said, yeah, I'll have a quick game of cards, or I'll read a book to you, you know. And so many people have died because of that. You know, they can't eat properly with a spoon and fork, so they've gone onto a liquid diet. And they've actually died. You know, the last nursing home I was in, so many people died because there was no brain activity whatsoever, no stimulation.
So really important to make sure that you're constantly engaging with somebody, even if it's not the same sort of conversation that you might have elsewhere, that there's something happening for the person.
So if you show them an old photo with their grandchildren or somewhere they've been on holiday, you'd be surprised how much the brain thinks of that. I was in my one the other day, and I see my daughter, who's now 45, looking out the back of her caravan window, and she was about 3 years old. And when I looked at that, I remembered everything, where she was, how old she was, you know, everything comes back. I mean, your short-term memory is rubbish. You know, tonight I won't remember what I had for breakfast this morning. And
motion detected at your front door.
The things that happened 20, 30, 40 years ago, you remember as plain as anything. So stimulating the brain, that's what I do. I keep my brain stimulated by doing so many different things that in 7 years, my dementia advisor tells me that I haven't gone downhill, I'm still on a level plane, which is good for me.
Really important, really important. I mean, and I noticed a couple of the other things that you said about, you know, not using a loud voice, or not making questions very strong questions or demanding questions, because people might feel frightened, or that that actually the way in which a question's phrased might make it easier for somebody to understand. Are there other things like that you think are important when it comes to to talking to or communicating with people with dementia?
I think it's very important to get some forward advice.
Mm-hmm.
Care leader, go to the care leader and say, what does he like in his tea or coffee? 1 sugar, 2 sugars. Then you can change your question. Do you want a cup of tea? To I'm going to make some tea, 1 sugar or 2, or you take 1 sugar with milk. That question's taken out of their brain. You know, that fog is lifted a little bit. That's all we can see is fog. You know, on a bad day, you know, I can't focus. I can walk. My wife, who had no training whatsoever, when my doctor diagnosed me, I had no paperwork, no literature to say here's something to help.
That must have been tough. Yeah.
Only by pure accident. That's it's a bit of a story, but I was asked to go to a dementia club, which 7 years later I'm still going to. And there was a lady in there who just delivered the tea and the dinners and whatever you wanted. And she said to me one day, she said, I'd like to do something to help dementia people. I said, oh, she said, I'm thinking of taking a course in dementia studies. And she did. And then she went to her boss and said, I'd like to become a dementia advisor. He said, well, the best thing to do is get a guinea pig and learn off the guinea pig. So she'd choose me as her guinea pig. She'd come around every day or so and say, well, what about this? You know, I see this, see that. And 8 months later, she took her exam and passed.
Fantastic.
Yeah, so, and now she knows how to talk to me. She doesn't come in shouting and, hello, Tony, you know, it's all nice and gentle. But as regards training for the loved ones or helping the loved ones, from the initial start, I think there's nothing. My wife had to learn herself. So there's plenty of organisations that they can go to, you know, Dementia UK, that sort of thing.
Motion detected at your front door.
Don't worry.
I'm getting a lot of burglars today. There's a lot of organisations who they can go to who send people out, advisors, to talk to you, explain how to deal with your dad or your mum or your husband. You know, I mean, it's there. But we had nothing. We have to learn ourselves. She had to learn herself.
Very difficult. Yeah, very difficult.
Yeah.
Tony, I mean, I that's fantastically useful. I was really particularly struck by this idea of being able to talk to someone so that the fog lifts a bit, and being able to see, you know, through their eyes at how it might be to the person who actually has dementia, and getting to make sure that you know something about the person before you start asking a lot of questions, so that you can rephrase how you think about asking the question and make them easier to understand. I think we're about at our time now, so I just thank you so much. I mean, it's invaluable to hear.
Motion detected at your front door.
There are a lot, aren't there? Yes.
No wonder I've never got no money. It's all
it must be the cats. So Tony, thank you so much. And we'll have some questions at the end. But that's a really, really helpful place to start for us to think more about how to work well with people.
I mean, the easier the question, the easier the fog lifts.
The easier the question, the easier the fog lifts. That's what we should stick with. Thank you so much, Tony.
Okay, thank you. I've turned this phone off.
Okay, thank you.
Sean, we're going to go with Anne next.
Okay, all right. So Anne, hello. I'm not going to. I'm going to pass over to you to introduce yourself and to tell us a little bit about how you have found working with people with dementia.
Yeah.
Okay.
Yeah. So, hello, I'm an occupational therapist, as everyone has said, but I'm actually doing quite a lot of research at the moment, and research concerned with trying to improve the quality of long-term care, so care in care homes and nursing homes. So I'm really pleased to see we've got people here from care homes, and I think Tony's thoughts and ideas are really helpful. So the thing that I want to share my thoughts about is that, as many of you who do a bit with research will know, we're always trying to keep public involvement in research. In other words, whatever the research topic is about, whoever's most affected by that topic, we want them to be involved right from the very start, not just in the research answering questions, as it were, but right from the start, shaping what's important about the issue from their point of view, and then how best could it be researched. And I'm struck by Tony saying, being in the room in the nursing home and the door didn't open between meal times. And one of the things that I believe quite strongly is that whether you live in a house in a street or whether you live in a care home, you are actually still a member of the public. And I think it's quite important to have the opportunity to be involved in civic life. And so public involvement in research, I think, is one of these things that people should have an opportunity to do. But when we look at care home research, actually quite a lot of it does not go to people who live in care homes in order to get their influence and involvement in the research. It tends to go to family carers, people who work in care homes. And of course, these people have useful and important experience to give. But I think, as Tony's so well shown, none of us knows what it's like when we're not walking in those footsteps. So what Tony's also said is fog. There's a lot of fog there. And so how can we work with people who live in care homes to get their input into research projects that probably sound really complicated, might seem very distant, might seem very irrelevant to their everyday life? Well, in a big project that I'm involved with at the moment, and the project is about developing a minimum data set for care homes that would be useful to improve care, we decided from the start that we would work with people living in care homes by getting to know them. We get to know a small group of people who were interested in being involved members of the public, and we would go to the care home regularly. They would get to know us as researchers, and then we could gradually help them understand about the project, and we could get their views on small points at any one time about the project, so they don't have to engage with the whole thing and try and keep it simple. Now, of course, the big thing that happened to that was that we had the pandemic, and we as researchers couldn't be going into care homes to make relationships and meet people and get to know them over a period of time. And also, the care homes themselves had very little time to even think about how this could be set up. They were busy, as you will know, dealing with all sorts of changing requirements. So somebody, and it was a member of the Alzheimer's Research Network who'd been a family carer actually, and was a member of our team, came up with the really good idea that, well, activity coordinators or activity providers are still working in care homes. They are still working with people, trying to involve them in activities that are interesting and meaningful. And they really know the people they're working with. So what we've been trying to do is to work with activity providers, and I'll give a big shout out here to the to NAPA, the National Activity Providers Association, who've been really helping us in this. And so the activity coordinator works with people in the care home, and we meet up with the activity provider and try and tell them a bit about the research project and get their ideas for what would help communicate something about that project to the people that they work with. And some of those people are affected by dementia in a mild way, some in a more severe way, and some people, as you can imagine, with a mix of people living in a care home, not necessarily affected by dementia. So a real range of people. And so we have to come up with a range of activities to break down and communicate simply about the research to people who might be interested. And so we find that we try to use pictures and examples. We try and use examples like, supposing this was you having an appointment with the hospital, and then we might have pictures of a person, pictures of appointments at hospitals, and then also the care providers brought in things like bottles of tablets or examples of things that might happen in a hospital appointment. So things that can really help somebody in the fault to be concrete and to say something about their views of the particular topic. So we've tried to keep communication very much in the moment. We've tried to keep it simple and use plenty of visual aids, sometimes simple text, sometimes pictures, sometimes objects. And one of the things that we've found so far with doing this is that the people who did join in, and this is public involvement, so nobody has to, it's just there for interest. Some of those people really felt pleased about being asked and really felt pleased about having their views listened to. And what we also heard from the activity providers was that they learned something about people's experiences of the first topic that we asked about and talked about was information sharing about going to a hospital appointment. And there was information that came from that people were saying, I want to know when my next appointment is. I want to know in advance of the appointment where we'll go, what time it will happen, who will come with me, and things that you would think, yeah, I would want to know that too. But sometimes in the coordination that happens between the care home and the health appointment, some of this communication doesn't happen. So we found so far that people are interested to get involved and will get involved in different ways. And we're planning to do more of this and find out more about which ways are helpful and not helpful. But I am struck, of course, that this is a burden. It's an added demand for somebody living in a care home with dementia. But what I would say about it is that I think it's really important to try to, for anyone who's still interested, to try and offer that opportunity to be involved in an altruistic way, to make a contribution to research, to shape things. And I think that even the effort as we work on research, if we make this effort, it shapes our thinking for the whole research project and makes us really focus on what's important to people who are living with dementia, and in the case of the research I'm involved with, who are living with dementia in care homes and nursing homes. So that probably brings, I don't know how long I've been talking, but that probably brings me to the end for now.
Thank you very much, Anne. That's extremely helpful, and I took away a couple of key things about sort of using somebody who knows the person as a conduit for the conversation. And in you're talking about sort of the activity coordinators and how important they've been, and also that sort of process of using prompts. Not whether that's visual or objects, or so to actually make asking a question more easily accessible. Thank you so much. And we'll come back in a minute when we've got some questions and answers. Have we got Nathan with us? Nathan, fantastic. I'm very glad that you have managed to join us, and I am going to hand over to you. And as we know already, you are a relative, a carer of somebody with dementia. So I will hand over to you now. Thank you.
Thank you very much. Apologies in advance. I am in a public space, so if there's a background hum or a child squealing, that's my 6-month-old daughter. So I apologise for that. Yes, thank you for the intro, Sean. My name's Nathan. I grew up in Oxford. My mother is still a resident there. She's 76, and 14 months ago she was diagnosed with Alzheimer's. It wasn't a great shock when she was diagnosed because, to be honest, kind of knowing what I know now, she was showing signs of it for at least a year prior to that. We kind of staged a little intervention in that some of her friends came over and we all had a kind of very gentle kind of conversation with her about, we felt that her kind of memory probably wasn't as good as it used to be, and persuaded her to go to the doctors, at which point they referred her to the memory clinic. And as I'm sure a lot of people have experienced recently, the pandemic kind of blew any plans of kind of any kind of care package being put together. So she actually had to wait about 8 months until she was able to be seen. So she's been living with it for quite a while. You know, it's challenging for her. It's challenging for kind of her friends, her family, and really that's kind of what I want to talk about now, is just the journey that my mother and I have been on for the kind of the last couple of years, really. So I think one of the first things I want to say, and what I've realized, is that, you know, Alzheimer's dementia is something that's unique to each patient. And I think that's very apparent watching Tony recount his challenges and how he finds that it kind of fogs his kind of thinking and such like. Tony's aware of the fact that he has dementia. My mother, on the other hand, is blissfully unaware that she has Alzheimer's. Her short-term memory is just gone. So any conversations we have around the subject of dementia, which, by the way, I try and limit until we absolutely have to talk about something, because I really don't want to kind of keep reminding her about something that she's kind of unaware of. And that was kind of in a consultation with her psychiatrist. I think the term he used is, it's a kindness to let her forget, really. And I've kind of held that true to my heart. So it's kind of an interesting way of managing my mum, because all the things that her friends, myself and her carer do are kind of almost done in the background, because she's not aware that she needs them. And in fact, often she's very stubborn and refuses to allow people to help her, which I know is a kind of facet of Alzheimer's and dementia, whereby people don't necessarily feel they need the help or they want the help. And it can be very frustrating and, you know, quite upsetting sometimes, where I'm just trying to quietly support my mum in the background and she can become a little bit hostile towards me because she feels I'm interfering with her life. But, you know, this is what we do for the people we love. We just kind of quietly get on with things for their betterment. Something I'd say to people who are potentially going to be in my situation, caring for a loved one, or are already in this situation, is, you know, familiarize yourself with what Alzheimer's and dementia is, because, you know, nobody's born with an inherent knowledge of what it is and what it means to you and your family. I think there's a lot of kind of pseudo information out there, or perhaps, you know, we heard the term senile or a bit potty, you know, when we were kids. And I think without understanding what your loved ones are going through, you can't really aim to help them. So, you know, spend a bit of time, if there's a diagnosis, kind of understanding what it is and you know, what it means for them, because I think that puts you in a much better position to support them. And also, put the best care in place that they need, because it's not a one size fits all. It's not a quick fix for everybody. Different people are going to need different solutions for their challenges. I think the other thing that I kind of quickly came to grips with was the fact that this is not something that's going to go away. You know, it is a chronic deteriorating disease, and I think for me it was kind of getting my head around the reality that there are going to be difficult times ahead, and I think especially challenging in that, you know, normally the person I would go to with any kind of challenging emotional situations, or if I needed advice, would be my mum. And the kind of the time I need to talk to somebody the most about one of the most challenging things I'm kind of living through at the moment is my mum, and I can't, because she doesn't have that insight, and I don't want to bring it to her. So it's quite a strange situation. So for me, in regards to my mum, there are three things that are kind of always paramount to me in regards to how I approach my mother's Alzheimer's and how I kind of deal with her and treat her. It's firstly making sure that she's safe. You know, there are some practical things, like I got the Oxfordshire Fire Service around to fit new smoke alarms. You know, there are other things in terms of monitoring how she, uses her kind of cooker and stuff like that. You know, making sure that there are enough kind of keys that have been cut and that friends have them in case she loses them. So there are kind of practical elements there to make sure she's safe. And that's something that I work with her carer ongoing to make sure that, you know, we're monitoring to see if there are any kind of red flags about some things that perhaps she was confident with previously, perhaps she's not now, so that again we can reassess what the risk is and put more measures in place. The second thing that is always front of mind for me is the quality of my mum's life. So, you know, making sure that she gets time with the family, you know, seeing her grandchildren, spending time with their friends. You know, perhaps it's me encouraging her to kind of go out, or just even going into town to kind of do a bit of shopping, arranging hookups with kind of family who are perhaps not based in Oxford, just so that she's still enjoying it. You know, it's being diagnosed with Alzheimer's is not a kind of you know, the end of game. It's just it's a kind of a challenge that can be overcome to a certain extent, and I think it's important that you kind of bear that in mind when you are kind of dealing with somebody with Alzheimer's, is that they're not written off. You know, they are still a kind of, in many ways, a healthy person and still have their kind of hopes and desires, but just through a slightly different spectrum, you know, not a spectrum that we are used to kind of like viewing life through. And the third aspect that I always have front of mind with my mum is just maintaining her dignity. And I think that was something that really came across in kind of conversations with their psychiatrist. You know, from his perspective, you know, he wants to make sure that she maintains dignity through the kind of latter stages of their life. So, you know, I suppose not shielding her, but kind of stuff that she doesn't necessarily need to be exposed to, that could be distressing, things that aren't going to cause her kind of distress. Those are the things that, you know, we as friends and family and carers can shoulder back, so that she kind of can carry on with her life in the manner that she's accustomed to. And those are the kind of the three central tenets that I kind of stick to. I think in terms of the way that I like people to engage with my mum, and I think it's very important, it's just that, you know, like I said previously, she's still, you know, a human being. She's still got kind of a life that she wants to lead. So it's kind of making sure that whoever you're engaging with, and with under whatever circumstances, whether you're a professional, whether you're a carer, whether you're a kind of friend or family, it's just engaging in a humane way. You know, they're still loved ones to somebody, and whilst it could be challenging, it's important that they still dealt with as, you know, a human being, and not just somebody who's got Alzheimer's, not to be written off because, you know, they've got this kind of life kind of altering kind of disease. And in terms of the care, I think there needs to be consistency. For example, with my mum, she's been hospitalized a couple of times over the last kind of 12 months, and we had the NHS care team come in to make sure she was taking her meds. And whilst they were great, you know, it was a different care provider each time, and there wasn't that kind of consistency that I think you get with say a private carer, which is what we've got in place for my mum now. This person comes every day at the same time, and the most important thing for me, above and beyond the fact that she makes sure my mum takes her meds at the right time every day, which she doesn't, if she doesn't have kind of prompting, is that she's built up a really strong rapport with her carer. And for me, that's so important, because that feeds back into the quality of life. She's now got somebody that she sees on a daily basis that she really likes. You know, they go out for lunch together. You know, the carer calls her outside of her normal allotted time just to make sure my mum's fine. She said how much she kind of appreciates and loves my mum, which for me, living in London, is, you know, a really important facet, knowing that my mum's got that support. And the final thing, I think, when it comes to caring for somebody, is perseverance. You know, there will be rocky times. It is very difficult. It's challenging. You know, sometimes, personally for me, I question my own sanity. It's like, I feel just, I'm kind of questioning my own sanity sometimes. Like, have I had that conversation before? Did I say that? Did I not say that? So you've really got to kind of persevere with things and know that it's not always going to work. You need to be prepared for frustration, but you have to kind of learn to adapt and overcome. And it, you know, it kind of tests you in a way that perhaps you didn't realize you would be, and you can find sometimes some inner strengths that you didn't know that you necessarily had. So, you know, it's just being aware of that and kind of keep pushing forwards. I mean, an example for me is my mum is a lifetime smoker. When my first child was born, she switched to e-cigarettes because she didn't want to, you know, kind of pollute her home or our home with kind of cigarette smoke. And then one day after her diagnosis, I came to visit her in Oxford, and I saw she was smoking cigarettes, and she had no recollection of ever having smoked e-cigarettes. And I probably spent about a year trying to gently cajole her into going back to e-cigarettes. But to be honest, it's a losing battle, and I've learned to accept that now. And I think now I've accepted that my mother will never not smoke cigarettes, I find myself a bit calmer, because I know I'm not trying to fight against the tide. So it's understanding when to kind of push and when not to push. And I think that brings me on to my next point, which is knowing, you know, when to involve your loved ones in discussions. You know, again, they're still kind of, you know, human beings with their own opinions, their own thoughts. But sometimes I find discussions with my mum just become cyclical. And I know that for her own good, I have to make decisions in the background, which she won't be happy about. For example, the DVLA wrote to her recently saying that she was no longer able to drive. I didn't let her see that letter because, again, this goes back to the dignity. What benefit will my mum have from knowing that she can never drive again? It's going to take away that sense of freedom. It's not going to help her, but it is an absolute. So I sold her car quietly in the background. And at the moment, I'm kind of reminding her that, yes, I'm in the process of getting her insurance updated. I am in the process of getting her MOT sorted out, because as her psychiatrist recommended, kick things like that into the long grass, because it's not going to benefit her by knowing these kind of harmful realities. I kind of think that if she lives in a world where she will end up driving again sometime, it gives her a kind of an emotional support. It's frustrating for her, but mainly I'm kind of trying to shield her from some of the harsh realities of the condition she doesn't know she has. And that leads me on to my penultimate point, which is, you know, there is going to be guilt. You know, there's guilt I feel about things that I have had to do, decisions I've had to make without my mum's kind of consultation, because I know that without them, it's never going to happen. So I have to kind of take advantage of the situation, and that's exactly what's happening sometimes. And, you know, I feel bad about it, but I think the last point I'm going to say before I kind of hand back to Sian is that, you know, and this was advice that's been given to me by a lot of people who have kind of seen loved ones go through a similar situation, which is, you know, be kind to yourself, because fundamentally, in some scenarios, it is going to be harder for the kind of carer or the loved one or the friends and family to kind of go through this, because the person with the dementia or the Alzheimer's is going to be blissfully unaware, so it actually isn't affecting them in a material way. So just try and give yourself an easy time. Don't kind of wrap yourself up with guilt, and understand that you know you're only human as well, and you just need to do the best you can for somebody who is in this situation. So I think I'll leave it at that point, and thanks very much for giving me the opportunity to speak.
Nathan, thank you so much for that very honest story of what's happened to your mum and the journey that you've been on together. And I'm very struck by the honesty of how it makes you feel, as well as some of the things that you've needed to do, and some of the things that work in order to remember that, you know, your mum's not a diagnosis, she's a person with a life that she still wants to lead. And that was a very powerful idea, that actually, you know, despite limitations, people still have lives they wish to lead, and that we need to remember that. Thank you. We're going to have some questions now, and I think we're going to Douglas is going to be in charge of the first question. So
okay, so I'm going to ask Nathan the first question, mainly because I don't know how long Nathan's going to be with us. I know that you've got a busy schedule today. So the question comes from an anonymous attendee. It says, hi Nathan, do you feel an earlier diagnosis would have helped?
It's a difficult one, because, you know, again, and I don't want to sound like a pessimist, but, you know, this is a sliding slope, which, you know, generally will end up in one situation, which is the person's only going to get worse. But having said that, I think, you know, from consultations with the psychiatrist and the psychiatric nurse, you know, if there is an earlier diagnosis, then, you know, you can medicate earlier, which can arrest the deterioration kind of earlier, which means that the quality of the person's life might be, you know, better for a longer period of time. But, you know, I suppose my mother and I can only deal with the situation we're in at the moment. There's no kind of control group, if you will, to kind of see what it could have been like.
Okay, great. So there are a couple of other questions I've got for you, Nathan, and then I'm going to pass back to Sean. So would you have been happy if your mum could have been diagnosed in the community, in brackets, by her GP and or a community dementia nurse practitioner, rather than wait for the memory assessment service? And the next question, to hold on to that, is, did it dramatically, how has lockdown changed your mum? And did it dramatically make her more hesitant to seek health advice, or has it been gradual?
I think if we address the first question, and then you might need to remind me of the second question once we've finished the first one. But okay. Yeah, personally, I would have been happy for any kind of part of the medical community to have diagnosed my mum. I don't necessarily feel it had to be somebody from the memory clinic, but that was the kind of the protocol that was handed to us. And I suppose, you know, maybe like some people, you tend to kind of follow the advice that you're given. I mean, the long wait wasn't great, but I think, to be honest with you, the diagnosis didn't change materially my mum. All it did was give us something that we'd kind of, in the pit of our stomachs, known was there. Hearing something read out loud to you by a health professional, you know, knowing that there's not a lot really they can do apart from, you know, administer some kind of some pills that may or may not kind of help. The rest of it is neither here nor there. So I suppose if it was, you know, if we were talking about something like cancer, then absolutely I feel that, you know, having the diagnosis as early as possible for some kind of life-saving treatment. But I think with the kind of the Alzheimer's, you know, it just really helps cement what we all kind of knew in our stomachs anyway. Does that make sense?
Absolutely. I'm going to ask you the second question, or the third question, in a very brief format. So the pandemic has actually affected lots of different people, not just patients or carers around dementia. So the question was really, how has it impacted your mum?
I think it's made her more anxious. Like, my mum has lived on her own for 20 years since the passing of her partner. So she's a very independent woman and very capable of looking after herself, which in a weird way has almost kind of prepared her for a life of kind of Alzheimer's, if that sounds a bit strange. But, you know, trying to manage her through the pandemic, and obviously when there was the harshest of lockdowns, it was quite difficult. You know, I was kind of reliant on local friends to kind of go over and take care packages for my mum, on top of me visiting her and such like. So, and even now things are kind of getting better. You know, hopefully, you know, we're in the endemic. I think my mum's held on to the notion that we're still in a heavily kind of like pandemic kind of world, which, you know, is true. So I think what it's done is, because she doesn't have the ability to look at the progression of the situation, she's still very much stuck in, you know, the first lockdown, if you will. Like, she rarely goes out, you know, even with her friends kind of encouraging to go out. You know, the most she'll do is a kind of quick jaunt to the corner shop. Like, I don't think she's been into Oxford Town for about, you know, 2 years on her own. It's only when I come up to take her out that she kind of goes out. So in that sense, the pandemic it's made her way more nervous, more cautious. And I think in the long run, it's probably exacerbated her situation, because she just hasn't had the level of interaction she would have done, you know, prior to there being the pandemic.
Great, thank you very much, Nathan. I'll ask you, thank you very much for putting yourself on mute. Sian, if you want to ask the next questions.
So we had just a question to everybody. There's a question about how important do people think it is to enter the person's world, the person with dementia's world. So I don't know. Tony, would you like to respond?
Yeah, I think it's very difficult to enter our minds to see what dementia is like, because we're the only ones who can look through our eyes and see it. I mean, like Nathan was saying about the pandemic and staying in, that's exactly what we done, because I was so used to driving hundreds of miles a day, big responsibility, that I knew when the pandemic struck, I had to be responsible. And the best of all, I had hobbies I can fall on. I'm a great coin collector, and I value coins as well. So I had something to keep me occupied. I might have to have a look at the books more often, but it kept me going. But to try and get into our head and see what we're going through, I think it's an impossibility. I don't think you can. It's like on my cards, you know, what I have on my cards is dementia through my eyes. So I'm the only one who can tell you what dementia is like. You can't come into my head and see it. So no, you can't get into your head and see what dementia is like. You can only be told what it's like. And because mine was caught very early, I was well prepared. And I didn't mind being told either. I didn't mind being told what I had, because I knew if I kept myself occupied. But the worst thing I did was go on the internet and look up all sorts of dementias. And I had myself dead and buried within 12 months, I think. Whereas I didn't go onto the official site, I went onto the other site. So I advise anybody not to go on the internet and look up dementia, but to seek out professional advice like Oxfordshire, UK, Dementia Oxfordshire, that sort of thing. But you can't go into our head and look at what dementia is like. We can tell you what it's like, but you can't see it.
Thank you very much, Tony. That just reinforces quite how important it is to hear from yourself and other people, so that actually it's not the same as some of the other experiences where we might be able to imagine what it's like, but actually really listening to what somebody says it's like is really, really important.
That's all you can do.
Yeah.
That's all you can do is imagine what it's like. We can tell you something, you can imagine that. it's not the same as being there.
No, I think it is a really important distinction. That Anne, did you have a thought?
I think the thought that came to me about, rather than a thought perhaps of trying to enter someone's world, is a thought of connecting. And I think that is about listening, as you said, Sian. I think it's really struck by Tony, you know, the importance of a sort of quite gentle approach, and very small steps at a time. You know, so first of all, just being, you know, coming near someone, and then looking to see what's their initiative to me and what's my initiative to them. Being very probably important to be aware of all that we're all communicating all of the time before we even put words in our mouth. You know, do we kind of look all busy and hassled, and are we not even, you know, are we looking all around the room to do all the other things we need to do, or are we, you know, is our attention available to the person to sort of, so I think possibly we can't enter the world, but a sense of being prepared to really connect, I think might be important.
Thank you. Yes, that makes absolute sense, doesn't it? That sort of sense that actually, whilst I don't know exactly what it's like, whilst I might be able to imagine a bit of it, what I can do is be very present and pay attention and show that I'm paying attention, so that actually that connection can happen in whatever way possible. Nathan, did you have a thought?
I'm kind of on the same page as Tony, really. How can you possibly know the inner world of somebody suffering from a disease that you personally aren't suffering from? I think, you know, it's not like you broke a finger once and therefore you know what it feels like to have a broken finger. You know, it is a continuum. You know, each kind of like case is different. I mean, I think, again, it's interesting with Tony, because I could have a conversation with Tony about his dementia, whereas with my mum, I can't. So I don't even have a reference point by which to kind of try and think of it from her position, because she's completely unaware that she has a kind of a mentally degenerative disease. So I suppose the perspective I try and take from my mum is just trying to keep her happy. You know, I feel my role is that it's making sure that, like I said earlier, her quality of life is kept up. So my perspective is, how does my mum feel within herself, you know, rather than how is she dealing with her Alzheimer's. It's like, is she happy? What's going to make her happy? Would it be reading a book? Does she need this from me? Does she actually need me to back off? Like, my wife's a great mediator, I have to say, because again, you know, I'm sure people out there who have loved ones that have Alzheimer's, it can be really frustrating, you know, and you tend to be very frank and honest with the ones you care about. And my mum and I especially have had a very kind of fiery but loving relationship, and that's translated very much into what we do now. So there are quite a few head-to-heads that we have. So I have to kind of learn to, you know, back off and, you know, I suppose think of it, well, how's she going to be feeling? Especially sometimes when I have to tell her for particular reasons that she does have Alzheimer's, you know, especially when I had to get care in place. We had some very difficult conversations, and I had to keep telling myself, how must she be feeling about getting this news? It must be devastating, even though it was about the 20th time she'd heard it since she'd been diagnosed. It's sort of, for her, it's the first time she's had that news. So I kind of need to try and empathize with that reality.
I think that makes absolute sense. As you say, it's sort of, you know, it's more important in a sense that actually your mum's happy and what you can do to do that, deal with that for her or help her with that, than it is to necessarily sort of, you know, project into a space which is almost impossible to understand. I'm just aware of the time. And so I think we're probably going to wrap up now. We would just like to again thank all the speakers for, you know, a really great set of insights into the world of working with people with dementia. I've taken a couple of really key things away, which is that sort of, you know, that we're talking about working with people who are not conditions. They are people who have this idea that there is still a life that they wish to lead, and that actually our work is to support them to do that, whether that is as a carer or as a somebody who works in a care home or as a researcher, and that there's something again very powerful about that idea of helping people to lift the fog. And there's some really simple things about communication, about it being simple, about not raising your voice, not being demanding, as a gentle sort of approach, that actually what one wishes to do is to create some connection, to be aware that it's not just the spoken word that communicates how we are approaching something, that we want to be able to create that connection in order that we start to understand as much as we can from that person's point of view, and that the key things around safety, dignity and quality of life remain, no matter whether someone has dementia or not, and that we might want to be very clear about using other people who know that person well, whether that be a relative or a activity coordinator, in order to generate the sorts of connection that we mean that we can take people's views into account, even if they they have dementia. So Douglas,
just a couple of things to top and tail that. So this is, as I said at the beginning, 5 different aspects. It's a series of webinars. We've got some coming up. We've got one on the 10th of February, looking at children and young people in particular. And then we've got one early in March, and then late in March, the first on suicide and self-harm, the second on autism. So we will send out those dates, and as you can see the picture there, that's what we produce, or that's what our consultants produce, pictures like that in the roll-up. So if you have any questions, now there were a number of questions that came through, so around about 20 questions that came through. We haven't answered them all. We've got a record of them. We will make sure that they are included in the report, and that the video goes up on our YouTube channel of the Academic Health Science Network. If you have any questions, please do contact us at community.involvement@oxfordshireahsn.org, and then we'll be able to answer your questions for you. But I just want to take this opportunity to thank both our speakers and also our audience for joining us today. And we look forward to seeing you again soon. Thanks very much.
Bye, everyone. Have a good day.
Bye then.